You all know why we're having this discussion. The status quo is unsustainable. The markets are collapsing. The American people expect us to act. I understand I may be or may have gotten a letter from the Democrats saying they want to participate. Well, I would ask them to tell us what they think ought to be done, if anything. So if they're asking to participate, they must be conceding that the status quo is not sustainable. I certainly agree with that. Well, the working group that counts is all 52 of us, and we're having extensive meetings, as I said a few minutes ago, every day. Nobody's being excluded based upon gender. You know, you need to write about what's actually happening, and we're having a discussion about the real issues. Everybody's at the table, everybody. We just had a meeting. We just had a meeting for an hour. Everybody's at the table. We'll have another meeting for an hour or so tomorrow. Everybody will be at the table. Well, we are confident that if we keep talking, we can work out our differences and pass a bill. Obviously, as you've heard all of us discuss, the status quo is indefensible. The American people expect us to act, and we're in the process of working together to get to at least 50 Republicans, because no Democrats are interested in participating, to change the status quo, which is completely unacceptable.
Okay, good afternoon, everybody. Thank you. Earlier this morning, every single member of our caucus sent a letter to Leader McConnell, Chairman Alexander, and Chairman Hatch. In the letter, we urged Republicans to abandon their partisan attempt to dismantle the health care system and to force millions of Americans to pay more for less, and work instead with Democrats to improve it. The belief that we are committed to acting in a bipartisan, transparent way to improve our health care system, working closely with our Republican colleagues as long as they give up repeal, as long as they stop trying to undo the progress we have made in the last several years. Unfortunately, this is not the way Senate Republicans have proceeded this far. Instead of reaching out to Democrats to come up with ways to improve the health care system in the light of day, Republicans have put together a partisan, all-male group to craft a bill behind closed doors. I fear that our friends on the other side of the aisle are down the same path the House took. A handful of members make major changes to the bill behind closed doors. Nobody has time to review the legislation. There's no score. Members are forced to vote, and the result is just awful.